Okay, well, we'll get started. Um, Good evening, everyone. Welcome to the Community Mapping Forum. The purpose of this forum, this is just a space where we're going to debrief during the redistricting special session that's going on here in Alabama. We will also have a panel section, a panel discussion during each debriefing where we'll highlight certain issues that are connected to redistricting. And tonight we will be highlighting the connection between healthcare and healthcare disparities. If we can go to the next slide, I just want to go over the agenda. And thank you. And my name is Anisha Hardy, and I am the Executive Director of Alabama Values and Alabama Values Progress. For those of you who have been with us since the first part of this 5-part series, thank you again for joining us each evening. Those of you who are just now joining us, this forum is part 2 of a forum that we had ahead of the special sessions, where we pretty much just broke down what constitutes a fair map. We provided the community with education on a fair map checklist. What should we be looking for as these proposed maps roll out? And during Forum 2, we're using that foundation that we laid in Forum 1 to analyze the proposed maps that have come out of the reapportionment committee and that are being presented for this redistricting cycle. And today, we have a review of the congressional maps and a summary of the session. Okay, before we jump into our panel and summary of the session, we will have a review of the sessions by Kendra Majors, who is the media strategist for Alabama Values Progress. Kendra will just kind of unpack some clips from today, from the special sessions, just to catch everyone up to speed on what was going on today.
Yeah, so I've been doing this every night. So just tonight's recap comes from Monday and Tuesday's legislative days. Yesterday, we saw the congressional and state house maps pass out of the House, and then the state Senate and the state BOE pass out of the Senate. Then today, those bills were debated in the alternative committees, and of course they received favorable reports. So we'll see tomorrow they'll be back in the chambers, and probably we'll see them passed, much to a lot of people's dismay. Let's see, as I've reported for the last few days, and as we saw in the public hearings, there continues to be questions about transparency and access to information needed. And it's important to note that these complaints are coming from both Republicans and Democrats, so it's not a one-sided issue. On Tuesday, coalition members were given the opportunity to speak at a public hearing that was requested at the House committee. A point of interest is that the coalition also requested a public hearing in the Senate committee, but that was not honored. We had Cadet Stone of Alabama Forward and Felicia Scalzetti of AEPN and TOPS. They both spoke at that meeting, and we're going to play clips right now of the testimony that they gave during the hearing.
Good morning, everyone. My name is Cadet Stone, and I've been living in Montgomery for over 20 years, and I'm the data and training manager with Alabama Forward, a civic engagement coalition of 29 groups working to make Alabama's electorate more diverse and our election systems more equitable. I'm coming here today to speak about the state Senate map that is before the committee. Despite the history of the state's failure to comply with Section 2 of the Voting Rights Act, no comprehensive study of racial polarization was conducted prior to the creation of the state Senate map. Nor was a polarization study conducted before drafting of the congressional or state house maps. The failure to conduct this analysis places the state in a very vulnerable position with regards to liability for failure to comply with Section 2. However, there was time to conduct this analysis because the Legal Defense Fund conducted a racial polarization study as a basis for the congressional map in a report they submitted to the reapportionment committee. Based on our analysis of the maps proposed by the reapportionment committee, these maps failed to produce the number of districts that can offer non-white voters in the state of Alabama an opportunity to elect a candidate of their choice to represent their interest.
Are you talking about Congress or
come here.
state Senate?
State Senate map. Okay. For the state Senate map, the state should have at least 10 such districts. The proposed state Senate map cracks Black voting age population voters in urban areas across the state into rural districts, whether their voting strength is diluted, instead of pooling these voters to create majority-minority districts that would allow the non-white residents to elect their candidates of their choice. We are concerned about the inequitable impact implementation of the proposed Senate map and other maps will have on our election process. The lack of racial polarization analysis also leaves us very concerned about the state's liability for potentially violating Section 2 of the Voting Rights Act. There's still time to conduct this analysis and choose maps informed by it. Thank you for your service to our state and for considering my concerns today.
Can I ask you a question?
Yes, Mr. Rodney.
Wait a minute.
Ms. Stone.
Well, I know what you're talking about, but let me say something to you.
Okay.
That back in '82, I think the same thing happened. And we gonna win this in court. I'm so sure about it now. After last night, after the calls I got last night, we'll be in court and we're gonna run again. We're gonna do just like we did in '82. We'll run for a year until they catch up to it, and then lawyers have already told us prepare to run again. We're gonna run a year after they catch up. We'll be running again for our seats again because of the fact that, of course, we're gonna win this one. This is a hand down because of the fact that you cannot break the courts have ruled over and over against breaking up. Not keeping the counties whole, and we got at least 15 or 20 counties that are already whole. And so therefore they've already. If they want in South Carolina, North Carolina, and the judge ruled, that's what they ruled on is the fact that it should have a. Hey, don't worry about it. Hey, this was a slam dunk.
Now we'll hear Felicia's testimony.
Alicia Scalzetti, thank you for allowing me to speak before the committee today. I am representing the Ordinary People Society and the Alabama Election Protection Network as a redistricting fellow. I'm also a redistricting organizer with the Hometown Organizing Project, all of which are nonpartisan organizations. The proposed maps, in this case Senate Bill 1, is not reflective of Alabama as a whole. While the district lines make it appear the maps are more reflective and improve communities of interest, a close examination shows the demographics of representation have not changed. There are no additional minority majority or minority opportunity districts in this map. We have grave concerns about the maps presented and the process for engagement. I will lay those out in a moment, but I'd like to get to some details and make sure that those get on the record considering my brief time here. The statistics on these maps, 25 districts lean Republican, 8 lean Democratic, and 2 are competitive. This is important because the fewer competitive districts we have, the less actual voice that any residents have in electing their representative. It makes the primaries the real election date. And as we all know, our general attendance for voting as a state is not great, and it's quite low for state Senate and state House seats primary elections. Our communities of interests, especially in Alabama's urban centers, have not been honored, have been split up quite a bit. I wanted to point out a few things. So I know that the guidelines for these maps were that counties were supposed to minimize splits as best as possible. I understand that this is difficult. I draw maps myself. I know that things are not as clear-cut as they look. It also states, the guidelines also state to minimize splitting municipalities. And obviously when you have a city like Birmingham or Huntsville, you cannot fit that all into one Senate district. But there are a few quite egregious splits. For example, Bessemer has 26,011 residents in one district, in Senate District 19. It has 8 residents in District 16. Birmingham is, of course, split. You have 116,000 approximately in 18 and a few other districts. But in District 5, there's only 29 residents of Birmingham in that district. These are very, very small splits, and I understand we're working with census block numbers, but it's very troubling if you can have a town, for example, Vance, where you have 2,019 residents in District 21 and 73 residents in 14. There are multiple other examples of this happening. There are, I believe, off the top of my head, over 70 municipalities that are split under these lines. Sorry, give me one moment. Again, I mentioned that 25 districts lean Republican, 8 lean Democratic. We have 8 majority-minority districts. This means that Black Alabamians have 22.8% representation in this map, and they have 25.9% Black voting age population in this state. It's close to parity, but not exactly. We really should have an increased number of districts, and that is the exact same breakdown as it was in 2011. 25 districts leaning Republican, 8 leaning Democrat, and 2 in the competitive range. So again, the statistics have not changed, even though the lines have. The core of the districts remain. With no discernible change in representation, we are formally expressing our deep level of concern for what has been a flawed redistricting process. 27 of the 28 hearings were held during working hours. Many hearings were closed within minutes of starting, including the very last hearing. Within 30 seconds of that hearing closing, 2 people posted their questions saying that they were typing them out and had been closed. That hearing only lasted 4 minutes and 40 seconds. During this special session, I'm requesting that you center fair representation and right the wrongs of the past by creating fair maps that do not require litigation. It's long past time for Alabama to have fair voting districts that allow for equitable representation and equally distributed resources. Thank you for your time, and thank you for.
Yeah, so good job, Kadita and Felicia. That's a great way to hit them with the facts. Another clip I'm going to show you is during this specific public hearing today, a random lady named Wendy Pickering, she just showed up at the State House. She said she wasn't even there for the public hearing, but just by her going into the meeting, she was able to pick up on the fact that things just weren't going right. And so she gave her opinion on that to the committee. So we'll look at that clip now.
Not where I was headed to, but you know,
That's
God
okay.
works in mysterious ways, so I'm going to go with it. So I just want to make sure I'm understanding.
State your name, please.
Wendy Pickering.
Okay.
So I wasn't even planning on being in, like I said, in this room. I'm here for something else, but am I to understand that some of y'all did not get to see board maps?
Yeah, right, I haven't seen.
Okay, I'm also kind of confused because I had seen something yesterday about people not being able to see redistricting maps. Is that also true? I'm confused. I'm just trying to clarify.
But I'm sorry, I'm getting maps brought down here. There was an oversight in the reapportionment's office. They didn't bring them here. I thought they were here. So go ahead. What was your question?
I was confused on why some people are receiving maps and some are not. Not just for the board.
The maps were available upstairs in the Senate yesterday. There was an oversight in the reapportionment committee's office. They didn't get the maps down here. They're coming right now. It was just an oversight on reapportionment committees. They are available online, by the way. You can go online and look at all this stuff. And they've been released publicly. Anybody can go online and look at all the maps.
Bring the Senate maps too. Yeah.
I know, but I guess my concern is that y'all are all here together, and I don't understand why some people didn't know. I'm sorry, I'm confused. Like I said, it's a God thing. I don't know why I'm in here, but I just don't understand. And it doesn't seem like it's just with this. It was other maps yesterday that people were asking to get, and for whatever reasons, they're not getting them.
We released the maps publicly last week. Everything that we're talking about has been publicly released since last Monday. And, all you have to do is go on the legislative website, just the same way we go on and read bills and same way we we'll find out where our committees are.
Yeah, I'm aware of how y'all read the bills.
Yeah, well,
And,
well, ma'am,
yes, oh, you answered my question. I was just trying to figure out why some people did not know where the maps were when y'all were all here together, why it just seems kind of questionable, and that's all I was trying to clarify. Thank you.
Thank you.
So I'd like to point out that Pringle said that they released the maps on Monday of last week. They, the reapportionment committee, did not release those maps. We got access to those because of Representative Chris England. So that is just me fact checking him real quick. So looking back at Monday's meetings, the legislators continue to ask for more information and to a time to review the information, which they said they just got it. So they wanted to be able to make accurate choices for this. Some legislatures even offered substitutes for bills from Pringle and McClendon, and all of those substitutes were tabled. During the House meeting, Representative Hall questioned Representative Pringle on the information from the public hearings and what part was used to draw the maps. So we have that clip now also.
Hearing was used in the process of drawing the districts.
The whole process, the whole part.
The report, so are we able to have a copy of that report?
Yes, ma'am.
Well, is that available now?
Yes, ma'am.
So may I make sure we request that I get a copy of that report?
Well, it's not a report, it's a whole series of court reporters. I mean, it's a you're more than welcome to go down and read the transcript from all 28 hearings.
It is my understanding generally, and let me say this, I'm talking about a process, and I'm talking about a process by which there creates a certain level of confidence. It doesn't mean that you agree or disagree with it. One, we had 28 hearings. It seems to me that at some point during that hearing, we would have received a report from the hearings. That's one thing. That to me is significant. Two, the polarization study. According to the Voting Rights Act, that is a statement that should and is requested that should occur. You indicated that that is not the case, only if you thought that might be necessary, but that is not what the process says it should be. That concerns me.
So next, they also heard from Representative Charlotte Meadows. I talked a little bit about her last night. There's a little bit of, angst and annoyance from her constituents in Montgomery County because her core has been changed. But during the meeting yesterday, she spoke and said she did not receive a call from the reapportionment office to let her know that she needed to make an appointment to go over her maps, and that she did not have an opportunity really to talk about her district and to make changes to her district. So here's a clip of her talking to Representative Pringle.
Thank you for the recognition, Mr. Speaker. Mr. Chairman, will you yield?
Yes, ma'am.
I'm here tonight to speak about the process. And I'd really like to have a show of hands for how many of y'all received any kind of notification to call reapportionment and get an appointment made. Did anybody get that notification? Okay, I didn't. And when you went to talk with the reapportionment group, was there any opportunity for you to have an opportunity to look at your district and make changes? I didn't have that opportunity. So I'm just here to say that I'm not in agreement that we've gone about the process in the right way. I do realize that it's been a very speeded up process. And now we're at the bitter end of a deadline that's facing us where we have to get this done by November 3rd or the 8th or the 15th or someday in the very near future. But this body hasn't even, the public hasn't even gotten a map that they can see what district they live in. That's not available to the public. Y'all haven't gotten the whole entire thing that shows population all the way across the spreadsheet by district. I've got it because I went down and asked for it a few minutes ago. If we're really trying to be transparent and open and accountable, I have a real hard time with the way we're doing it. This is nothing against the committee, and I understand that the federal government delayed our census numbers from coming in. But if we have 2 more weeks, then maybe we should take 2 more weeks. If our special session was called, and we can extend it up to 30 days and we have 12 days to get it done, it's my opinion that we should be taking closer to 12 days versus 3. Thank you, Mr. Speaker and Mr. Chairman.
Yeah, so pretty much the same kind of conversation went on in the Senate yesterday about lack of transparency and about they didn't get the access to the information that they needed either. I'm not going to play this clip because it's way too long, but if you have time, we have them on Vimeo and we could post the link in the chat in a few minutes for you guys. But there was an interesting go around between Roger Smitherman and Senator McClendon. Smitherman just was asking for this large map so he could see down to the streets in his district to see what had been moved around. And it took, it took really almost like an act of Congress for them to agree to get that for him from the reapportionment office. But eventually they did. Then a little bit later, Senator Singleton also talked to McClendon about how they actually drew the majority minority district in the congressional. He wanted to know, talk to him about how they've been saying all week, Pringle and McClendon, that they didn't turn on the race factor as they were drawing it until after they'd done that. Of course, Singleton, he questioned that statement, and then you can see that in the clip. I just thought that was really interesting, the back and forth between them. So we'll look at that now.
Or to turn it off and say you came up with what you came up with, Jim?
Well, in areas where there could have been some racial unfairness, we check our numbers. We check our numbers when we need to check them, just like we had certain districts sent off to a specialist to analyze them, make sure we weren't being unfair to any particular groups. So, yeah, because but it was a different process than 10 years ago. Sure was.
Yes, but the thing about it is that what gets me is that, and it says that to me, whether or not there was really any major innovation thought put into it, is because everybody's district is still shaped just about the same that they were 10 years ago. And so I think that what we did was we started at those boundary lines and move out or moved in or stretched forward or stretched out, because even in my district is still shaped the same way. Even if you did it blind, you got me shaped basically the same way, except even when you did whole counties, except that I lost a county too, and instead of a finger point, I got an elbow, and that's what's happening. And so that's why I don't know whether or not everything was totally blind, because everything stayed the same, in terms of drawing. But at least you followed the whole county methodology, and I appreciate that. You followed the 5% deviation and on the rules, and I appreciate that. So, but I still think that, at the end of the day, on some of these splits, you say you go for how many splits, from 26 the last time down to like 18 now?
I think it's 26 down to 19. 26
to 19. Okay. And the majority of your splits are going to be Jefferson, Tuscaloosa, Montgomery, right?
So as you can see, many of the legislatures had the same questions that a lot of Alabamians and members of this coalition have had. But not enough to have taken an interest to stop the passage of the maps to create more fair and equitable maps. So you can keep up to date by following Alabama Values Progress on social media, and you can also view the committee and chamber meetings on the link that I'm going to post in a minute in the chat. Thanks, you guys. Let's see.
All right. Thank you. Thank you, Kendra, for that update. And the clips are very helpful. Just as some of the legislators were calling for transparency and accountability, I definitely think showing those clips and just unpacking those during today's session can aid in increasing the transparency during this process, especially for those who are unable to attend or watch the sessions. All right, well, as we move on to the next portion of tonight's agenda, as mentioned, each night we'll be having a panel, a mini panel discussion regarding a core community issue that's connected to redistricting. And redistricting is connected to so many issues. Healthcare, criminal justice reform, representation. Well, tonight we will be talking about redistricting in healthcare and also, Medicaid expansion. We'll be joined by Jane Adams with Alabama Rise, the Cover Alabama campaign director, Susan Carney, League of Women Voters, Mobile, and also Kendra Majors with Alabama Values Progress. So if, let's make sure that we are. All right, so we can just jump into this evening's discussion. As mentioned, redistricting is definitely connected to healthcare. The way the lines are drawn, they directly affect funding, the funding that we receive for healthcare services. And people may not realize, just in Alabama over the past decade, how many hospitals have closed. I think the number is about 17 to be exact. And our rural areas are really impacted and hit hard by the closure of these hospitals. And some rural areas, some people that live in rural communities, they have a 25 to 30 minute commute, to a hospital. That means if there is some type of critical issue that happens, that 25 to 30 minute commute could be a matter of life and death. But I just wanted to hear from the panel in terms of, definitely now we're going through a pandemic. When we think about COVID, what has that meant for Alabamians in terms of our healthcare system and also the resources that we have, and just considering the strain that COVID has put on the spotlight that it has shined on the gaps that we have currently in our system.
Well, I'll take that one.
Okay.
Yeah, so again, Jane Adams, and I lead the Cover Alabama Coalition. I am talking quietly because my 2-year-old daughter is sleeping next door.
I get it, look.
Where it's the struggle of being a working mom is real, but I'm honored to be here. Very, proud member of the League of Women Voters, and, honored to be participating in this really important conversation. So yeah, you're absolutely right, Anisha. COVID-19 has laid bare the inequities in our state in a lot of ways, but one of them is access to services, essential services like healthcare, prescription drugs, grocery stores, voting, transportation, housing. It really has just exposed a sore that was already there on our state. And specifically when it comes to health insurance, Alabama has one of the highest rates of uninsured in the United States. We are one of 12 states that have failed to expand Medicaid. There are 340,000 Alabamians who are either uninsured or underinsured. We're talking about construction workers, daycare workers, a lot of low-income working class voters in Alabama. And when you talk about, how do we recover from COVID, you have to point to the reality that we were in a worse situation to begin with because of our failure to invest in healthcare and the health and health equity in our state. Our failure to expand Medicaid, it costs lives. Like, there's no way to deny it. When you have 8 rural hospitals close, then people are dying, right? They're not able to access care in enough time and they die. They're not getting, detections. They're not getting preventive care. They have more complex health issues. And I know, our resident nurse here is going to explain more about that later, but it just, the delaying of getting treatment of care because of uninsurance causes medical debt. It's causes more expensive treatment options. It, prevents hospitals from being thriving financially. It causes rural hospitals to close. I mean, there's just so many reasons why we are in a worse off position as a state than, our perhaps states like Arkansas or even Kentucky, who have expanded Medicaid and invested in health insurance and healthcare for their low-income populations. So I'm going to stop here for a second and let Suzanne chat for a second.
Yeah, I think everything you said, Jane, was right on. My name is Sue Carney. I'm the advocacy lead person in Mobile, and I'm a retired nurse. And I've worked in numerous healthcare settings throughout the country. So I'm coming here with kind of the practical side of, what do you see when you're actually taking care of patients and so on. But the pandemic, I think is very interesting. I mean, the pandemic is really just a microcosm of the whole reason why we have healthcare, the whole reason why we want healthcare coverage. It's, nobody, I'll bet, in 2019 would have said, hey, next year, everything's going to shut down. We're all going to be sick and it's going to be horrible. Gee, let's get ready. Nobody said that, because that's not the way people think. It's not the way it works. You have to be ready. So healthcare, you've got to have it ready to go. You can't just like pop up one day and say, okay, we're here in the middle of nowhere. We're going to take care of everybody. No problem. It just doesn't work that way. So I think that's where Medicaid expansion really is so important, to have that healthcare system in place for everyone. Alabama has got world-class healthcare institutions. I mean, UAB, here in Mobile, we've got the University of South Alabama, we've got USA Children's and Women's. I mean, those are great places, researchers, and so on. But if you don't have access to it, if you don't have a way that you feel comfortable going there, then so what? So that's kind of from the practical side. That's how I see it.
Yeah, so, and I have a little bit different perspective than either one of y'all. Before I was the media strategist at Alabama Values Progress, I was a almost 20-year newspaper editor, publisher, and all across South Alabama. So I've been in a whole bunch of markets, and I've kind of seen the same story in smaller hospitals. Even before the COVID-19 pandemic, they were struggling to keep nurses, struggling in general, especially since we didn't expand Medicaid. And specifically, like last year, in Crenshaw County, in the middle of COVID, their hospital almost went under because there was several things going on, but just COVID really just wreaked even more havoc on it because they didn't have enough nurses and their staff was just really, really, overworked, and they just couldn't handle what was thrown at them because nobody was prepared for what was thrown at us. So anyway, and the sad part is that their commission was like, hey, we're going to pass a property tax so we can keep this funded because it's they have a healthcare authority.
I remember paying attention to that. We were going to we'll get into that. People are being taxed to keep a hospital open. But they're being doubly taxed. I'll explain it in a second.
Oh yeah, but the people in the community were like, no, we don't want to do this. Y'all figure this out. Which I would just like to say that this was like that hospital specifically saved my granddad's life. Like, he had a heart attack, and had we not have the ability to drive 6 miles up the road, he would be dead like a long time before he died. because they were able to stabilize him before they sent him to Montgomery. But you know, without the hospital, that would be the story of so many people. So anyway, that's just part of, you know, some things that I've seen.
Yeah,
talking about that as we go.
Yeah, so I'll just say, you know, there's just really quickly, like, you know, we have stories. We have a full-time story collection coordinator that's, you know, a part of our staff, for her to tell the stories, you know, to publish the stories of folks who are directly impacted. She just published one on AL.com about a woman named Kathy who, you know, didn't have health insurance for a long time, started to feel sick, had a cough, but like didn't go in, went in, found out it was lung cancer, but by the time she had gone in, it had metastasized to her brain. She tried to move to Illinois with her husband just so she could get Medicaid expansion. She made just too much as a part-time hairdresser to qualify for Medicaid, but not, she was 3 years away from Medicare. And Kathy died in the coverage gap. I mean, there's no short way around it. Kathy died a sad, painful death and left behind her beloved husband, 7 grandchildren. You know, I mean, when she died, it was during the peak of COVID, and, you know, they went to 3 different hospitals before they were able to find one in the Birmingham metro area that was able to take her in. And there's no reason why Kathy should be dead, right? I mean, if she would have had health insurance, she would have gone to the doctor regularly, right? She would have gotten mammograms, she would have gotten early detection and screening. There are women that are walking around our state right now who have cancer in their bodies, right? And they don't have, that going to the doctor's office and getting that screening is a bill that they can't think about, right? And a debt to another rainy day, right? Mm-hmm. And so they're just walking around with cancer in their bodies because of our failure to expand Medicaid. When you think about the impact that has on communities, right, and workforce, like, people can't go to work. You know, it's just like, it's a very complex. It's not a complex issue, right? Like, people need health insurance, and the federal government will cover 90% of the cost to do it. So the expansion of Medicaid is probably one of the most important issues that our state is facing and our residents are facing.
Yeah, and I think that's a good point to make, and a great way to pivot into the next portion of the discussion. I mean, we've shared how the impact of COVID, the impact that COVID has had, particularly in Alabama and definitely in rural communities, and also the effects of or the not having health insurance coverage.
Yeah,
that has had. But then there's an opportunity for us to, you know, pass Medicaid expansion to aid in eradicating that issue. But why has Alabama, you know, been unable to pass the Medicaid expansion? I mean, I think this is a great way to pivot into the need to have representation from those who understand the community's needs to give us a better shot at having the much needed healthcare opportunities that all Alabama.
Yeah, that's what we're here to talk about.
So
right?
so let's dive into the connection to redistricting and how having fair maps can help, you know, achieve equitable healthcare in Alabama.
Yeah.
So let's talk about why, you know, Alabama has not.
Yeah, I can't remember. Thank you, Anisha. I can't remember. I was astonished. I can't remember who was testifying about the districts that were cracked, where there was like 8 residents of one city in a district, and then the rest were, you know, like like 8 residents of Birmingham, but the rest were Bessemer.
Yeah, that was Felicia. We got receipts. We can drop.
Yeah. So how in the world is that representative supposed to adequately represent 8 constituents from a completely separate district? Their hospital, their schools, their whatever. It's impossible. And the reality is that when you don't have communities that are kept whole, right? Then the issues, like, say for instance, right, like, there are communities not very far from where I live in Madison County where, you know, we've got a great hospital here, but if you look at some of the districts, it goes out pretty far out, that is really struggling with keeping doctors there, with keeping rural providers, OBGYN services. But if you were just, representing this core hub in downtown Huntsville, not representing, not really focusing on any of your constituents that live quite a good distance away and have different needs than you, you aren't able to understand the fact that this healthcare crisis and this failure to expand Medicaid has these ripple effects. But there are legislators that do, look, I think we're in a better, when it comes to Medicaid expansion, we're closer than we've ever been before. And I think it's because COVID has laid bare that no matter where you live, no matter what zip code you're in, anybody in your family can get really, really sick and need to go to the doctor and go to the hospital.
And I think that's something important to remember too about healthcare in general. It is totally non-discriminatory. It affects everyone. I mean, it's important to everyone. And the interesting part I find in Alabama is that everybody, I say everybody, that's totally wrong, obviously. Many people on all sides of the fence are interested in expanding Medicaid. I mean, we have
exactly right.
Certainly populations, needy populations that are white and Black and Latino and Asian and everything. It affects them all. They are generally don't necessarily have a lot of funds to be able to have insurance. However, then we have a whole cadre of people who are, the Alabama Medical Association, the Alabama Nurses Association, the Alabama Hospital Association. Those are all folks who want Medicaid expansion. So it baffles me. I'm not exactly sure if the legislators simply don't hear their people talking.
No.
Because it's everybody kind of saying
No. I mean, we've contacted the governor, our coalition, right?
Yes.
We have 114. We have 114 coalition partners, including the Medical Association and others. It's something that the Business Council of Alabama wants to see get done. What it takes is creative problem solving, right? We have a problem, which is we would have to participate in this federal program, which causes the state to have an initial startup cost, right? But I think legislators, look, and if it's not directly impacting them, if it's not on their top number one priority, they're not going to spend the effort on it.
Yeah, and I was going to say, speaking of their top priority, I mean, if you have leaders that, representatives that don't have a connection to the people that they're serving, then this is not on their priority list. And I think that's,
and we've I have the receipts, right? We called the governor one day we called the governor 600 times. We shut down her voicemail inbox at 10 a.m. to ask her to expand Medicaid. We've emailed legislators 14,000 times, emails, right? We have over 6,000 people that have in our state that have contacted the governor in the legislature about this. So for me, it's if you can't access and represent your constituents, if you aren't a legislator that's willing, that knows your community, and your community is a whole community, right? It's not this disparate areas that aren't truly representative and community oriented, then you get into situations where it doesn't matter that, hundreds of your constituents have called you and left voicemails, I mean, which is bad.
And, and another component to it is not only we talked about Medicaid expansion, but we haven't talked about people who have insurance but can't afford to use the insurance that they have because their deductibles are $5,000-$10,000 and they don't have that kind of money, or the fact that they're going broke, because paying for the insurance is taking up their entire paychecks because they barely can make it anyway, and they're paying for insurance that's going to break them if they have a major medical issue.
Yes.
So that contributes to our healthcare crisis also.
Yeah.
I think there's a big ripple effect also from not having healthcare coverage, because when you have a parent, let's say, who becomes ill, ends up being in the hospital, is worried as can be, how am I going to pay for this? And the way it's set up is that hospitals, if you come to the emergency room and you have an issue that requires you need to be seen and then possibly hospitalized, they cannot, they can't like refuse you. If you need emergency care, you get emergency care. But that doesn't mean that at the back end, you're not going to get a big old bill for it. You're going to, and everybody knows that. So it affects, the ripple effect comes when you have children who are worried about their parents. They don't do well in school. You have families where everybody has to contribute to paying for the hospital bill. And so consequently, they don't have funds to, put towards healthier food or maybe better housing or any housing, or, that ripple effect, it affects all of us in reality, because all of us end up paying it's not a tax necessarily, but we end up paying in some way, either in higher insurance rates or for the insurance that we do pay for, or for other social programs and so on. And it does not make for good outcomes, does not make for good outcomes at all.
Yeah.
No, I'll just briefly share on that ripple effect. I just want to pivot a little bit about the fact that we're already paying for this care, right? I mean, we all pay our federal taxes, most of us, right? I'm assuming we all pay federal taxes. I would hope you do. We all pay federal taxes. And in fact, Alabamians have sent $4 billion with a B, since 2014, $4 billion in federal income taxes that has just gone to Medicaid expansion in 38 other states. So we've sent $200 million of our tax dollars for Arkansas to keep their hospitals open and to provide health insurance to their folks.
Yeah, I think Kentucky.
So the worst part, Kendra, is that you are, already paying taxes for Medicaid expansion in Louisiana, right? Or in Kentucky or in Montana, or let's just in Hawaii, your tax dollars are going for Medicaid expansion in Hawaii. And then your rural hospital is failing to close because our state refuses to invest in healthcare and bring those tax dollars back home. And so they try to tax you guys again, just to keep your rural hospital open. I mean, there are people in Alabama who are being perhaps taxed into poverty because of how much they're, paying in federal taxes and the, taxes they have just to keep, the costs that they have to keep a rural hospital going. So it's just a huge job creator too. I mean, look, 14,000 healthcare jobs, 3,000 jobs in the retail industry. We're talking about restaurant workers, essential workers, right? Like the people who are working in construction, the folks who are working at your gas station, the folks who are working at restaurants, and all of these other places are uninsured or cannot afford insurance. I will say though, I will say really quickly that if you go to healthcare.gov right now, it is open enrollment time, and you can. Health insurance is cheaper now than it has been in forever, essentially, especially if you are lower middle income. So definitely go to healthcare.gov and check that out.
Okay. As we, wrap up this panel, thank you all so much for joining us and for just discussing, again, the healthcare disparities that are in our state and just how it's connected to fair maps. I know this comes around once in every 10 years, but the impact and issue of it lasts year round, you all, until the next 10 years. So we have to get involved and stay involved. And I think through community forums such as this, I think it's important to show everyday Alabamians that redistricting is just not this silo issue, that it is connected to so many core issues that we all should care about and value. So thank you again for joining us and for providing such insight on this topic. And at this time, we are going to move into the next portion, which is the map discussions, analysis of the maps. And we'll start with North Alabama. And we have Patricia Keene, Robin Bucklew, and Stephanie Barnett. Okay.
Pat, this would be the time for you to talk about A&M.
Yes, I have the map up here. This is the reapportion map overlaid by the 2011 map. This is North Alabama. This is the Madison County area. And I have it labeled the city, but it's not showing up. But this is the Huntsville, Alabama area. And the first thing you should be able to see is how bad it's cracked. We have a district, Senate District 7. We have a Senate District 2, 7, and 9 that splits up Huntsville. So when I focus in on Huntsville, I can see where the old lines are, but I want to talk about in particular this area where Alabama A&M University is at. And if you're not aware, Alabama A&M is a HBCU. Do you see in this area how they drew most of A&M out right here?
Wow.
They drew most of A&M out of this Sam Gibbon, and they put it over here under a rural senator. So not only is it cracked, but the new representative has nothing in common, nor can it relate to the issues of urban area, the city. This area here at Alabama A&M is a predominantly Black area. I can go in here and show you some of the neighborhoods. This Lakewood Community Center, this Bob Harrison Center is African American. They are building up here in this area. They looped around some of the Black areas to give it a rural representation. And then they came back up here in the north part and scooped it back up. So what I want to explain is that they did a very good job in cracking Madison County, and in particular, Huntsville, Alabama. I do not know what's gonna happen. Hopefully something will come down where it will make them change this area. But Huntsville, Madison County area is cracked in about 3 or 4 4 districts. And this is not necessary. 2, there is enough for us to have a minority representation, as many African Americans and other individuals. The population could stand a senator that we could probably elect as a minority. Anybody have any questions or anybody want to add?
I have a quick question. Has the A&M community gathered together or considered their litigation options for the cracking that's going on in their area?
I do not. Let me say this. We just had a discussion Sunday after going over the maps Saturday with Laura Hall, who is our House representative, and also informing her and our House Representative Anthony Daniels. So I would say the majority of the Alabama A&M community does not know. Immediately, when I get through explaining this map, I am going into another discussion about these maps to explain to a huge group of Alabama A&M graduates. And yes, we're going to discuss the cracking and how bad it is. And I will request what resources are available to see if we can seek some type of action to have this remedied.
So I'm Pam, this is Jane Adams. I live here in Huntsville, and I've been paying attention to this district because I live in Senator Van Gavant's district, and I've always thought it was outrageous how it went all the way up to Tennessee and all those other areas. It's just, again, outrageous. And the fact that they purposely cracked A&M out of there is also wild. So my question is, you know, we like sharing it with social media. I'm thinking like sororities and fraternities, like the Divine Nine, getting them involved in this effort that their representation's being taken away. Like they've been purposely singled out and cut out of the rest of Huntsville. Or, you know, the rest of that area in Huntsville, downtown North Huntsville. So, you know, any way that we can just get even just like a zoomed in shot of how egregious that crack is, so we can like get a picture of it, share it with A&M, Twitter, Facebook, Snapchat, like that type of stuff. Share it with some local groups here. Let me see if I can get a screenshot of that, of how bad it's cracked. That's just wild.
Is you tell me you.
That's what we're doing tonight, I think is, and also I think what Pat is doing, talking after this. So I think it's happening. It's just that, you know, obviously this is something that's just late breaking, and we wanted to make sure it was shared here.
Yeah, Laura Hall was not aware of it when we talked to her over the weekend. She had not seen it and didn't know.
This is a huge problem. I mean,
well, and I think that's what you're seeing is, you know, by this coalition digging into the maps, we found this problem, and that's Pat was, you know, and Pat's carrying it back to people, I think, in the A&M community right now.
Yes, I'm part of one of the sororities in the Divine Nine. I'm a Delta.
You're
and
a Delta.
at 9:30, I'm getting ready to talk to some ladies of Delta Sigma Theta about this map.
Yeah.
Okay, well, I know AKA sisters, so I'll talk to the alphas, and I'll share it with some other local groups as well.
Okay.
Who would they contact? Like if they're outraged about this, what are the action that we're telling them to do?
That's what I want to know.
Well, I think let's just, what we're trying to do tonight is to talk through the issues, not to solve it here, but one of the questions, there was a question in the chat. So why don't we'll get through this issue and then finish the discussion on North Alabama. Then we need to move down and talk about the rest of the state.
Well, let me just take that question. The cracking is going on in the urban areas of the state. We really haven't seen it in the rural areas. The rural areas tend to be either very African American or very white. And so it's not, the state legislature is not particularly interested in cracking them. But if you go into any urban area that has a significant African American population, then you're going to see cracking and packing. And it's very prevalent. I just wanted to bring up one other issue as long as we're still on North Alabama. I talked to this last night about the House. It's also true in the Senate that in the urban areas, it tends to be, when you say it's plus or minus 5% deviation from the ideal, it tends to be plus 5% deviation. So the urban areas are packed with people. The rural areas tend to be less than ideal populations. And what that's doing is it's diluting the urban vote. It's diluting everybody's urban vote. And because the urban areas are the areas that are growing in the state, it means that they're 5% over now. They're going to grow to 10% very rapidly. I would venture to say that since it was census data, that by tomorrow morning, many of these districts are going to be more than 5% over in population, and they're going to continue to get worse, most especially in the fast growing areas, which are in North Alabama, in the Huntsville area and the Limestone County area, and also in Baldwin County.
Thank you, Robin.
Yeah, one of the things that I think this is pointed out when we were looking at this area that Pat was describing is that it wasn't until we zoomed in and started looking at the individual districts that you really noticed the fact that they had cracked this community so thoroughly. And it's because Pat and several of us, are familiar with this community that you see this. And this is why it's so important for communities of interest to look at their areas and understand what's happening in their communities, because sometimes it's not obvious unless you know your community. And so, Pat, Stephanie, did you have anything that you wanted to mention here about the Senate maps tonight? Or anything?
No, nothing to really add on to what Pat and Robin have already said. It's just very obvious that HBCUs continue to be impacted by gerrymandering, regardless of what state you live in, regardless of what city the HBCU is. And so it's just definitely really frustrating how they continue to crack and pack and just dilute the impact of the Black vote.
Yeah, definitely. And I was just wanting to say to everybody, Jane and the folks online, that this is a very serious issue, and we're not, we're bringing it to the table here tonight, but there's going to be a lot more that you're going to hear about this, because this is unacceptable, and the people that live there can't. I mean, this is not something that you can just live with, and it's basically voter suppression. So I think if you guys, I think we'll move on to Central Alabama. Thank you. All right, Misha, I'll switch it back.
Okay, thank you, Patricia, Robin, and Stephanie. And now we'll transition to Central Alabama with Felicia Scalzetti and Cadet Stone.
Just 1 minute. I'm trying to find them on the list here.
I think we just have Felicia Scalzetti.
I'm trying to rejoin from my laptop right now. Sorry, y'all. Give me 1 second.
That's okay.
So it's just Felicia.
Yeah. Well, while we're waiting on Felicia, just to our viewers, if you're watching, just as a reminder, if you have any questions, you can put them in the Q&A section, which is to the left of the chat icon at the bottom of the screen.
Okay, it's not letting me log in, so we're just going to have to do this like this. Sorry, everyone. Oh, now you're typing. Okay. Sorry, everybody. I was in Montgomery this morning, as you saw, and I quite literally walked through the door about 5 minutes ago. And I was desperately trying to get here so I could get on my computer before we started. I cannot see, are we sharing a map right now so that people can see the areas that we're talking about?
Well, shoot. Okay, hold on. Is it a load? Okay. What do you want me to look at?
Starting to, let's start in Jefferson County because you know, home is home, and then we'll swing out to Tuscaloosa and then go south from there. So Kathy, if you could turn on county lines, please.
Okay. It's not really acting right, but yeah, there we go. I think
a lot of people are
okay.
likely using it tonight.
Sorry.
Okay.
One sec. It went away. Okay.
Let's see. All right. So that's Jefferson County. Jefferson County is obviously super populous. So we have a lot of people. So we're going to be split up into multiple Senate districts. But what actually happens in this map is that just like what we talked about last night with the House, the Senate map is split into 7 different pieces. So we have 7 different representatives that represent Jefferson County. And you can see that yellow district, which I believe is Senator Reed's district, comes in and kind of gets like that swath of Jefferson County to the left. You can see that we've got that, I think it's Shea Shelnut coming in from the north in 17, that purple district. And most of these districts are going out and grabbing, you know, a lot of rural areas outside. You can see something similar happening with, I believe that's 15, the orange district at the bottom. So what's happening there is that there are only 3 districts that are totally contained within Jefferson County, and there are 3 majority-minority districts, meaning that there are Black majority districts, and they are the Dem districts. And the 4 districts that go outside of Jefferson County and grab those big swaths of rural area are actually the Republican districts, and they're represented by white men. Jefferson County is a Democratic county. We are a, we're not a Black majority, but we are white minority. We're majority POC. This is not representative of Jefferson County. And you might say, well, of course, and this is what Pringle said this morning, which is that Jefferson County does not exist in a bubble and that everybody needs to be added to a district, which is true. However, Jefferson County has enough population to have 4 districts totally contained within it. It currently only has 3, and enough population to go outside for 1 additional district. So only 5 districts in an ideal map would touch Jefferson County, and with some leeway, maybe 6, but this 7 split gives Republicans and white people control over this county on the committees in the state house. And as a result of home rule, which we can get into some other time because that's just really just getting into the weeds. You can really, I'm sort of debating how much to really get into this, but in this map, if you could, Kathy, do you know where Talladega is?
Yeah.
Yeah, if you could zoom into Talladega.
If I can move it. There we go. Talladega is right here. That's
right. So I believe that Talladega is now whole on this map. It's not in the house, but you can still see there's a lot of like funny business with how thin that funnel is and how it's going down. That's actually Senator McClendon's district, that green one. Let's jump over to Tuscaloosa. Okay, so Tuscaloosa is split into 3 pieces. It's not surprising that Tuscaloosa would get split up because not only is it a populous county, but it's a populous county surrounded by a lot of rural districts. But what happens here is getting that middle swath cut through. It really disenfranchises people who live in Tuscaloosa. It also disenfranchises people living next door because you're going to have very different concerns. You are very, very different needs of the community. You have different, just different things that you need to be represented for, and people deserve to be represented adequately. It's also a racial split. So what they've done is they've kind of separated that population north of Talladega from the rest of not Talladega, Tuscaloosa. I'm mixing up my T words today. You've separated that top part of Tuscaloosa from the southern part. And that's really not how Tuscaloosa is divided. They did keep, as far as I could see, the university whole in this map, but it's not an HBCU. It's University of Alabama. Ever since Pat mentioned that, I've been trying to look at other HBCUs and see if we have similar issues. I haven't found any in my areas yet. But there's
one in Tuscaloosa. It's
there is. I meant
Spelman, I think it is.
Yes, there is. I'm saying I didn't see it being split on this map. So I'm saying I haven't identified any HBCUs in my general areas that have been split so far, which is a good thing. But where we'll have to go through this with a finer tooth comb. As has been mentioned multiple times, we've only gotten access to these maps basically in the last week, and they've been tweaking them as they go. So we have to keep checking and keeping up to date with things. Is Kadita still not on or not able to get on? Because if not, I can hit some things about Montgomery and Tallapoosa.
Yes, please do.
Okay, so if we can go down to Montgomery. All right, and I'm sorry y'all for not being able to break out the numbers because my spreadsheet isn't up. But all those numbers I was talking about in that testimony that Kendra played earlier, I was talking about this map, the Senate map. And so one of the areas, one of the cities that's split, municipalities that split, is Montgomery, which we would expect. But again, the way it's split, you can kind of see that little finger towards the top that leans in and just grabs people. I believe Alabama A&M is here. I believe their campus is entirely contained in that district. So we're not seeing splitting there explicitly, but there is a question of where people live off campus. That becomes an interesting problem as well. Let me think. And I just want to hit Tallapoosa and leave it alone. If we get back up a little bit.
And that's Alabama State University, just FYI. I know you were just coming from their Alabama A&M, but that would be ASU.
What did I say?
Alabama A&M.
Sorry. Yeah. I'm butt whooped for saying that.
Exactly.
But you're going to have to help me find Tallapoosa because I'm not as familiar with that.
It's that. Do you see that green, bright green? Your mouse is off right now. Yeah. So what I'm actually doing is I'm showing Tallapoosa going into Lee County. So Lee County was one of our fastest growing areas. So the Opelika, Auburn area. So Opelika and Auburn were split very, very suspiciously in the old lines. And so now they've sort of ameliorated that instead of splitting Opelika in half, they've moved it down. But now you're splitting Opelika and Auburn like this, and it is more or less along racial lines. You also have this issue up here in the north part of Tallapoosa with Alex City and with the surrounding communities there going into Dadeville. So I believe Dadeville is in 27, but you've separated it from Alex City and kept the top part of the county. So that's, somewhat problematic. And you can see how big that district is quite long. So it's going all the way down, it's grabbing Auburn, and that little tip at the corner, that's Phoenix City and Smith Station, if I recall correctly. So if you look at Smith Station and Phoenix City down there, they've got 3 different Senate districts sort of converging on that one spot. So there are lots of little, it's just very interesting where they put the lines. It's not as obvious as in the old maps where you could just turn on overlays and see, but when you look at the makeup of each one of these districts, it's almost identical to how they were before. So visually, a lot of these maps look cleaner, but when you look at what the actual representation is and how they're made up, you just see just an overall dilution of Black voting power. That's really the bottom line of all of this. So again, sorry for not being able to show you all this myself or to pull this together, but thank you for letting me speak.
If I could just interject real quick, this is Stephanie. I live in Huntsville. However, I did live in Montgomery for a couple of years for grad school. And I will say, while like the brunt of ASU is together, the neighborhoods that you were talking about, Felicia, where it's that kind of really strange finger, it is some of the neighborhoods I would say that ASU students likely live in, because while it looks like it's like mostly taken care of, and any Montgomery residents I'm sure can correct me if I'm wrong, but from what I remember, these streets that start turning into the next district, which is sorry, the number is not showing up, the next district is it's pretty wild, because it really splices into those neighborhoods. It's a lot of your second, third, fourth, fifth streets, and then some of the streets that are over, which, I mean, that's a very, I wouldn't say necessarily off the top of my head it is one whole neighborhood, but I mean, they share a lot of common, like a lot of similarities. And so I would say that off the top of my head, it at least kind of splits up the ASU students. And it certainly shares a lot of communities of interest.
That's what I meant about it, subtle, right? It's like, it's a lot harder to prove. I mean, it's not harder to prove, but it's easier for them to get up there and say, well, we didn't split the campus in half, or we didn't do this direct thing, but we know what the impact is on the community, and the fact that they just did not honor communities of interest when drawing this map.
Well, thank you. Thank you, Felicia, for going over Central Alabama for us. And next we'll move on to South Alabama, and we'll be joined by Shalila Dowdy and Suzanne Carney.
Good evening, everyone. So with South Alabama, we are mainly focused on Mobile and Baldwin County. So Senate District 22, 33, 34, and 35. And our big issue right now, on surface level, it doesn't look like it's an issue because some things remain the same. Mobile was originally consisted of, or right now it consists of 3 Senate districts, but the new proposed map has a 4th district coming into Mobile County, and that's a rural district, Senate District 22. Let me see if I can share my screen. And so from this map, Senate District 33, so the only Democratic Senate representation that we have on the Gulf Coast would be Senate District 33, which is Senator Vivian Figure's district. And right now, the new proposed map has her district extended into Baldwin County, and it's a semi-rural area of Baldwin County. If I when I change it to the partisan aspect of it, you can see that she's picking up a red area. And so that's not a community of interest. We want to keep our counties whole down here as much as possible. And if you look at the map above the blue, the brown is Senate District 22. That's one area where we feel like she can possibly take in Republican voters that are inside our county, instead of having to go across the bay, because those people across the bay don't want to be in her district. She testified, or she spoke about this yesterday, that they've already let her know, they don't want to be in her district because they're Republican voters for the most part, and they would be represented by someone they feel like doesn't have their interests at heart. So they don't even want to be in the district. And the other issue is Baldwin County is it's growing. Baldwin County along with Madison County were the 2 fastest growing counties. So if Baldwin County continues to grow, that area can also continue to grow, and their population could increase, and the voters that are present will probably be the same type of voters that will come into that area, and it could dilute the the Black voting power or the Black voting presence in Senate District 33. And so you have to look at this stuff long term. Like right now, it's like, oh, the demographics of Senate District 33 is still majority minority, you know, it can be won by a Democratic representative. But we have to think long term. If Baldwin County continues to grow and continues with the same pattern that we have right now, that we're in jeopardy of losing that Democratic representation. And that's a representation that we need to fight to keep, because the city of Mobile is Democratic. And so if that goes away and everything at the bottom of the state is red, as we all know, that won't be proper representation. Looking at our other Senate districts, there really isn't much of an issue with those. They're majority, they're red. The county of Mobile County is red, the city's blue. So it would make sense for there to be 1/3 or 33% of a representation to be Democratic. We only have one HBCU down here. It's a community college, Bishop State, and all of Bishop State is inside Senate District 33, and along with those local surrounding communities. So there's no splitting of HBCUs, but there can be some shifting around with some of these precincts, like I said, where if we have to have some of 22 come into Mobile County just because they need the numbers, or if Mobile and Baldwin County has to merge, it should be up north, the northern part of Mobile County, because that portion of our county is more rural, and that portion of Baldwin County is rural as well, and those two are more of a community interest than coming down here and having to hop across the bay. Sue, did you have anything that you wanted to?
All I want to say, Shalila, is that you did a great job. Thank you. I think you hit everything that we talked about on Saturday. Up here, there's a little corner up there, up District 34, up there in the upper right-hand corner. That's where they chipped off a piece of Mobile County, to and added Mount Vernon into Senate District 22. That is a small, it's not a big community, but it is a blue community. And so they're going to be sitting out there like an island in a big sea of red, basically. So that's, right there. So that's going to be, a little tough. But yeah, I mean, there's been a lot of press here about just how upset those people, the people in Baldwin County are. It is a very rural area. So lots of farmers and so on, and they just don't believe that they will be represented by Vivian Figures, who is a longtime Mobile resident and lives smack dab in the middle of her district. So it is a problem.
The 3 Senate districts in Mobile, they're all sitting around 136. They're at the minimum of the deviation, but House 32 is sitting at about 150,000. So if the rural district, the Brown, the 22 needs people, they can get them from from 32, because that Senate district is the most populated one down here. Is sitting at 150,000, about 14,000 people more than the surrounding 3 districts. So there can be some shifting. The maps have been approved for the most part. So I don't know. It's frustrating because we know that Senate 33, like long term, is in jeopardy of possibly.
And the issue is the population shift. There's no doubt about that. I mean, Baldwin is just growing very fast, and there's a fair amount of population that crosses from Mobile to Baldwin and vice versa every day, because they work in Baldwin County, they work in Mobile County, they're going back and forth. So, I mean, from that standpoint, there is kind of a melding there, but it's that northern part of Baldwin County where District 33 picks up all that area without picking up a whole lot of population. So that's a problem.
And that's all we have for Lower Alabama tonight.
Okay, thank you. Thank you so much. Okay, well, we are approaching the end of today's, this evening's forum. But before we go, we provided so much information regarding what's happening in the sessions, connecting redistricting to healthcare, and then also analyzing the maps. And we do want to take a moment to just share with everyone how you can get involved in the redistricting process, as well as other civic participatory processes or activities in our state. And so we've dedicated a portion of the form that's just to share information about other organizations that provide resources or other initiatives that will help you get involved. So I am joined by Rodrisha. Hi, Rodrisha.
Hello, everybody. Good to see y'all again on another evening of community mapping. My name is Rodrisha Rusaw. I am the Executive Director of the Ordinary People Society here in Dothan, Alabama, and also co-founder of Alabama Election Protection Network. We thank you guys once again for joining this evening. As Anisha said, she's going to share more information regarding Shake the Field, Alabama, which is a digital space dedicated to increasing civic engagement and awareness and connecting everyday Alabamians like yourself with organizations and events to help you be a part of the movement and to build Alabama in the way it should be shaped.
Yes. And actually tonight I'm sharing Shine a Light, Alabama, but that's okay. We did share Shake the Field.
Okay, so
that is okay. Yeah. So, but I'm going to share information about Shine a Light, Alabama, which is pretty much a community-based effort to aid in remembrance and healing during the loss of COVID and the pandemic. How befitting, because like I said, our panel discussion, our focus for tonight was on healthcare. And so I'm going to share my screen at this time. Hold on. Let's see. Go. Okay. So Shine a Light, Alabama is a community-based initiative. And the premise behind this initiative is that, you know, as a country, well, the whole world has gone through or experienced loss due to, you know, some sort of loss due to COVID-19. And we thought it was, you know, as we approach talking about getting involved, and right now we're talking about redistricting and other civic engagement activities, that is very important to acknowledge that, you know, people are also grieving during this time. And this is a resource that provides, hold on, here we go, that provides a way for you to remember your loved ones, and also resources regarding, you know, healing, resources for health and vaccines, grief resources. My screen is moving a little slowly, but resources for, you know, for counseling. And then a unique feature of this website, there's a digital memorial wall to where if you just want to honor your loved one, you know, or you know, a friend, you can come here and you can upload by clicking honor your loved one. It can be an image or just any information you would like to share about them, and they'll be added to the wall just for those who, a memorial wall, just as a method of remembrance. I wanted to just take a moment and share a brief video clip regarding the initiative. And here we go.
Hitting a new
sorry.
COVID-19 case numbers have been climbing, hitting a new daily.
So much loss.
500,000 confirmed deaths.
What do we do when so much is lost?
Cases are definitely spiking across Alabama.
To a virus, to overdose, to suicide, and violence. In our homes, our communities, our neighbors, and parents, and friends. How do memories of loss become sources of inspiration? We keep their light alive. We tell their stories. We commit to our communities. We build the future by shining brighter. We remember. Together, we can move from loss to light to legacy. Learn more by visiting shinealabama.org.
So yeah, again, shinealabama.org. There are also, oh, I'm sorry, here we go. There's also a resource in terms of civic engagement, like some of the information you heard tonight regarding getting involved. I'm sorry, it's still on full screen. Go. There we go. If you go to the Together in Civic Engagement tab, there's organizations that you can connect with, Cover Alabama Coalition, Alabama Forward, organizations that are advocating and fighting for Alabama to provide quality and affordable health care coverage. So again, thank you for joining us tonight. And Rodrisha, for those who want to tap in and get involved, can you just share, in terms of them contacting their legislator, the resources that are available for that?
Yes, that's no problem. Nisha, thank you for that beautiful video, Shine a Light. And I just want to remind everybody that as we're fighting on the front lines and providing education around redistricting and civic engagement, that our country, our state is still hurting. And so that is a great resource to make sure that you stay plugged in as we continue to move this work forward in Alabama. As far as Anisha, what she stated is, yes, we are asking all Alabamians, everybody, to participate in contacting your legislators. AEPN, which is Alabama Election Protection Network, has a website that you can go to, which is voterprotection.org. And also you can submit a letter directly. And if you having a hard time writing a letter, you can actually generate a generic template to be able to send to your legislator. We're asking you to get involved so that the legislators through the redistricting process and map processing, that your voice is not missed during this process and that it's heard through every step of the way. So once again, we thank you all for this evening and thank you for attending today's forum as well.
Great. Thank you. So we will see you, we'll see everyone next forum, and just be on the lookout for email reminder. And thank you for joining us this evening.